So moving into the symptoms specifically, as you can see on the image on the right are some of the symptoms I explained and what categories they kind of fall into. But starting with cognitive symptoms, it has been found that in patients with schizophrenia, there are deficits in the prefrontal cortex, which is responsible for working memory, context processing, and attention. So when things go bad, it can lead to bizarre behavior, anhedonia, and flat affect that we see in some of those symptoms in patients. Next, for negative symptoms, it has been found with, again, deficits in the prefrontal cortex, basal ganglia, and ventral striatum. The ventral striatum contains the reward center, so when these function abnormally, individuals lose all motivation and show negative symptoms because they're not receiving the rewards they usually would be doing for activities. And now for positive symptoms, it has been found that abnormal functioning is in the temporal gyrus, the prefrontal cerebellar, temporal, and cortical regions. These regions are all involved in processing speech and observing actions, and some of them are sensory and some are non-sensory, so they all kind of tie in together and produce a lot of what we see in the hallucinations, most of the time being auditory hallucinations in patients. And although there's a lot of inconsistencies amongst a specific set of symptoms that somebody with schizophrenia experiences, the most consistent findings have been ventricular enlargement and hippocampal abnormalities. Specifically with ventricular enlargement, it kind of makes sense just because if your ventricles are enlarging, that means that the other parts of your brain are having to be compressed or shrink. So we see a lot of the damage with all of these different parts of the brain, and it can produce a lot of the symptoms that we end up seeing in patients.